Hi dear friends, this is Dr. Ram Pathuri, dermatologist and hair transplant surgeon, and welcome to my YouTube channel. So friends, today let's discuss about a medicine that almost gives a heart attack to the patients who are suffering from baldness or hair loss. That is none other than Finasteride. If at all there is a contest to rate the most rejected drug by the patients voluntarily in this decade, I totally believe that Finasteride would stand in the first place, followed by oral steroids which were given during COVID. So as a doctor, please allow me to educate you by walking through the actual facts regarding Finasteride. And also, do watch this video till the end, where I explain you the summary of points that you should be aware before taking Finasteride in the case of baldness. Before going any further, to just hit that subscribe button over there and hit the bell icon. And do share these videos to your friends who really need help with their hair and skin problems. So let's get started and see the history of Finasteride.
Finasteride is FDA approved medication to treat BPH and baldness in men. Finasteride was first used in 1992 to treat benign prostate hyperplasia at the dosage of 5 mg. That is, since 30 years, this medicine has been there in the market. In 1998, it received approval to treat male pattern hair loss or androgenetic alopecia at the dosage of 1 mg. This is 26 years back. So why are we having this controversy? In 2012, FDA has asked the manufacturers to mention on the label that few people are reporting few sexual side effects like decreased sexual drive, problems with ejaculation, and difficulty in achieving erection. So since then there is a havoc going on in social media against the Finasteride without knowing the true facts. Even though after this happened in 2019, Finasteride stands as 86th most commonly prescribed medication in United States with more than 8 million prescriptions. So you have to understand that how beautiful drug this is. Of course there are side effects, but still it is a very important drug, and the risks are very less, whereas the benefit is very high.
The summary of this topic is, the drug is not a new drug to doctors to experiment on people. We have an experience of at least 20 years with the same drug. So now let's find out how Finasteride works.
See, it's very important for us to understand how Finasteride works. Finasteride doesn't kill any cells in the body or stops any hormone production. It works by inhibiting an enzyme which converts testosterone to 10 times more potent form of testosterone, which is called as DHT. That it just acts for a limited duration. The most active time of the drug, or T half of the drug, is only from 6 to 8 hours. After that, most of the drug is eliminated in feces and urine. You should also note that the drug doesn't get excreted in semen.
By this, we should understand three very important things. 1. The drug is very short-lived in the body. Second, it does not damage or kill any cells that produce the male hormones. Third, it doesn't get excreted in semen, so men taking Finasteride can have their babies. If you are a male, and unless you have fertility issues or family history of infertility, you can plan your family even while taking this drug. How much Finasteride is dangerous?
The maximum dose of Finasteride you can consume in a day without any serious issues is 400 mg. Can you see that? It is 400 mg. That means it is 400 tablets of Finasteride, which is given in a case of baldness. 80 mg taken daily for 3 months didn't also show major adverse events.
What are side effects?
Guys, side effects is one that has become one of the most commonest term used by every patient around the world without understanding the actual meaning of the word. Any substance that is consumed has its own desired effects and other effects which are not desired. which are called as side effects. Some unnecessary effects can be permanent, but many would be temporary. For example, common salt that we consume daily gives us desired pleasure of taste, but when we take in higher quantities, temporarily raise blood pressure, and when consumed in excess can cause immediate nausea and vomitings. These are side effects of salt. Let me give you another similar example. Cold tablets like cetirizine or hydroxyzine can help in decreasing the cold by decreasing the running nose immediately, but can cause dryness of the mouth and excess sleep. These are side effects. But when these medications are given for weeks together, even in higher doses for skin allergies and other diseases, they don't give the same side effects anymore. This is because the body finds a way to deal with temporary side effects and adapts to the medicine and gives us only desired effects.
So summary of this thing is, we should understand that every substance, though it is natural or factory made, has desired effects and undesired effects, which are side effects. Most of the temporary side effects are ignored by the body itself when they are taken in the long run. What are the side effects of finasteride? Are they permanent?
Here we see a beautiful article from one of the most prestigious journals of India, IJD. They have gone through number of studies which were conducted on thousands of people and summarized that 2 to 4% of patients, which means 40 out of 1,000 people, developed side effects and also were majorly temporary. They came back to normal on continuation of the medication and also after stopping the medication. So here we should understand that even continuation of the medication will help you improve your side effects. Here is another beautiful study with finasteride dosage at 5 mg, which was done on 17,000 men over a period of 7 years. The result in the study showed that the sexual dysfunction was very less and the impact diminished over time. This study concluded that the effect of finasteride on sexual functioning is minimal in most of the men and should not impact the decision to prescribe the drug or to take the finasteride. One of the most recent articles which assessed finasteride in 767 men between the age groups of 18 to 82 with androgenetic alopecia has concluded that finasteride does not result in sexual dysfunction in men with AGA. Okay guys, of course there are studies and reports that state finasteride has permanent side effects of sexual dysfunction, depression and post-finasteride syndrome. The reports are very less in number compared to the studies which were done to actually assess the side effects, and these studies lack proper evidence and have many limitations.
The summary is, there are hundreds of perfectly done randomized controlled trials which studied large number of patients that state that sexual side effects are seen in only 2 to 4% of patients that take finasteride for baldness, and these also state that the side effects are temporary, whereas there are also dozens of studies which have lot of limitations that show that finasteride has serious and permanent side effects. So what do we need to do? Do we need to take the drug or not take the drug? Let's summarize all the summaries and come to a conclusion. 1. This is not a new drug in the market and it has been there in the market since 30 years. Number 2. This is one of the best drugs in treatment of baldness, as it addresses the root cause of baldness. Number 3. Number of studies have shown its safety over long duration of administration. Number 4. The drug given in 1 mg is very small quantity and unlikely to cause permanent side effects. And coming to the 5th point, even in the cases where side effects are reported, the changes were found to be reversible either by continuation of the drug for a longer duration or by stopping the drug. 6th point is, if you are not among that 4% men who had side effects in the studies and if you are neglecting this medicine, you should understand that you are risking your head. Coming to the 7th point, that is my opinion regarding taking this drug, is that you should take the drug for yourself. You know that 400 mg of finasteride is maximum toxic dose and you are just taking 1 mg. Yes, you might have little side effects for 1 to 2 weeks. Be confident that they are temporary. Give some time, at least for 1 month. If you feel that there are sexual problems, then you can stop the drug. you should be totally fine within 3 days after stopping the medicine. 8th point is stop the drug immediately if you are having pain in the breast region or in your testis. Visit your treating doctor, they will tell you how to deal with it. 9th point is don't even touch the drug if you are a pregnant mother. 10th point is if you have family history of infertility, depression and suicidal tendencies or high grade prostate cancers, just inform the doctor so he will suggest you alternate approach. The 11th point is if you are above 45 years of age and if you have difficulties in passing urine, then get a PSA test done before starting the medication. And coming to the last point, if you have baldness and if you are a smoker, it is better to quit smoking as it will aggravate both baldness and also your sexual dysfunction. So that's it, my friends. I have given my honest opinion in this video and the choice is left to you. Please do share this video with your friends who are having hair problems so they don't miss out the true facts. If you have any doubts regarding Finasteride, please do ask me in the comment section below so that I will reply to your questions in the question answer session in the end of the month. Thank you for watching this video.